All right. Hi, everyone. I'm Thiv, co-founder and CEO of Hera Fertility. Glad you can join us. Today, we're going to talk a lot about PCOS and infertility. And we have Dr. Colleen Denny with us, who's going to talk a lot about PCOS. So before we get right into it, can you share a little bit about your background?
Sure, thank you, Thiv. I'm Colleen Denny. I'm an OBGYN. I practice in New York City. I'm a generalist OBGYN, which means I take care of people throughout their lives and sort of manage reproductive health concerns. And very glad to be talking about PCOS today, mostly because I think it's really common. It affects so many people, and it can have different effects in your life depending on which stage of your life you're in.
Yeah, super excited. So let's get right into it because for me, when I first heard of it, I was like, what does this acronym mean? And um, why why am I hearing about it now? And what is it all about?
Sure. So PCOS stands for polycystic ovarian syndrome. We've known about it for about 100 years. Um, and it's a syndrome, which means it's a collection of symptoms and lab findings and ultrasound findings that people can have that sort of can look different in different people. But the main things that sort of characterize PCOS is that people have irregular periods, usually less frequent or less predictable, and that lasts for many years, not just occasionally, as well as signs of androgen excess. And that means that they have more signs of exposure to male hormones than most women do. So that might look like male pattern hair growth, like on the face or the chest. That might be even male pattern hair loss, sometimes later in life, or things like acne, signs of excess hormone exposure. In addition to these two things, there's also this idea that we know PCOS is associated with long-term health problems that tend to kind of have a pretty wide range of what people are worried about. A lot of them are sort of cardiovascular risk, so that's like heart problems, issues with high cholesterol and high blood pressure. But also it affects the way that the body can process insulin, which is associated with diabetes.
Mhm.
So we know that people who have PCOS are more at risk for having insulin resistance or diabetes, having high cholesterol, having high blood pressure, or even risks of certain types of cancers that are consistent with their hormone exposure. So lots of different things play into this diagnosis of PCOS, only some of which might be immediately apparent to people as actual symptoms.
Wow, that's a lot that people have to go through. So, how does the process work in terms of diagnosis? And then I'm curious how people even manage this condition.
Yeah, usually the diagnosis, what people can really see in terms of the symptoms they have tend to be either very irregular periods, and those tend to have been lifelong. Ever since they were a teenager, they report that they have unpredictable periods where they'll have a few months between periods, maybe even fewer than like 9 periods in any given year. And or they might have those symptoms of high androgen exposure. So that's like hair growth, acne, male pattern hair loss. Some people might have both, some people might have one or the other. Um, but those are usually the reasons people present to their primary care doctor or their gynecology doctor, looking for an answer for that. And that leads us eventually to this diagnosis of PCOS. And it's pretty common. We think that about 5 to 10% of all people who identify as women have PCOS or meet criteria for that.
Wow, it's that prevalent.
Yeah.
Okay, and then one thing before we get into how PCOS affects fertility, I'm curious is how do people what have you seen people do in terms of managing this condition, be it lifestyle changes or any medications there?
Yeah, it's a good question. Because PCOS can look different for different people. And also, people are at different stages of their life in terms of what they want from their periods, their fertility, what other medical problems they're dealing with at the same time. Managing PCOS can look different for different people.
Mhm.
Generally, we want all people to be healthy. So we're thinking about maximizing our patient's health, decreasing her risk for those heart problems and those diabetes in the future. But
Mhm.
then we think about fertility for PCOS patients. And one of the issues for PCOS patients is that because they're not, or rather, the sign that they're not having regular periods means they're not regularly having an egg, which with
Mhm.
they can conceive, right? Pregnancy requires a sperm to meet a mature egg outside the ovary and land in the uterus. You need all those things to actually conceive and carry a pregnancy. And in a normal cycle, when people have a normal rise of hormones from the brain and the ovary, they make a mature egg about every month or so, and they have a period about 2 weeks afterwards. In PCOS, that cycle of hormones from the brain, hormones from the ovaries is disrupted. It's unorganized and it's not synced up in a way that can actually mature an egg and actually predictably release it from the ovary. So if you don't have that egg, it's really hard to get pregnant. Some people don't want to be pregnant, in which case we're just, thinking about having to create a better period for them that's more convenient for their quality of life. But if you do want to get pregnant, that can really be problematic because these ovaries aren't making eggs reliably and you can't use them to start a pregnancy.
Gotcha. Well, let's get into the fertility side. Before getting into specifics, I'm curious, like, from your like your background and experience, do people with PCOS know from the get-go that they might have issues with infertility? Like, piece that together?
Sometimes. So sometimes people are diagnosed very young, right? They present early with irregular periods or these androgen symptoms, and they have a doctor who recognizes it at PCOS fairly young. So they might not be at a stage in their life where they're looking to become pregnant. Um, People with PCOS sometimes have a mature egg. It's just unpredictable. So this might even be people who've had a pregnancy in the past, right? They were lucky enough to catch a mature egg when it did come out, even at an irregular interval. They were
Mhm.
able to get pregnant, and later on, they're realizing they're having more trouble. And when they think back, they're like, "Oh, actually, I've never had regular periods. My whole life, they've always been a little bit unpredictable." So
Mhm.
sometimes we make this diagnosis much later in life. Um, but I think that's one of the first questions when we meet adult patients is sort of what their fertility goals are. What are they, aside from all the heart
Mhm.
and diabetes issues that we always want to take care of, what is the next step for you in terms of your family building and what your priorities are?
Gotcha. Okay. And that's why it's an important question to ask. Okay, so for the what we're noticing just as a tidbit here is that at Hera, we're seeing a whole bunch of patients coming in that have this PCOS diagnosis.
Mhm.
And so I'm curious if someone is in front of their doctor wanting to have a preconception or fertility planning or just to get a fertility assessment happening,
Mhm.
um, what what goes through the doctor's head in terms of fertility planning then if someone has PCOS?
Yeah, I think that's a good question. So in terms of for someone who knows that they want to have a pregnancy, they're looking for fertility, right? They have PCOS, but they want to conceive. Um, I think of all the things that I know can help people have regular ovulatory, which means a cycle that creates an egg, how we can have regular ovulatory cycles. And
Mhm.
there's a couple ways we can do that. Some of those things are just lifestyle management, which I can talk a little bit more about, lifestyle changes, especially weight loss. And some of those things, either by themselves or can be combined with weight loss, involve fertility medicines. We
Mhm.
have medicines that can kind of help the ovaries to create and then release a mature egg more regularly so people can take advantage of that with PCOS and plan their intercourse accordingly.
Wow. So yeah, let's first start with the lifestyle modifications. What are a few tips or things that you would stress upon the patient
Yeah.
here?
So PCOS patients, we know generally they often have these hormone changes, endocrine issues. Um, they are more likely to be overweight or obese than the general population. Not everybody who has PCOS is obese. Not everybody who's obese has PCOS, but there's a higher likelihood of those things happening in the same person.
Mhm.
And we know that lifestyle changes that lead to weight loss are associated with better PCOS outcomes for fertility. So we know even not even a big weight loss, even something as low as 5% of your body weight, not even like the bigger numbers, 40 or 50 pounds that sometimes people say to themselves that they want to lose, even small amounts can restore normal ovulatory cycles. And once people are ovulating more regularly, having regular periods, their fertility increases. So
Mhm.
we think of all the things that might be affecting someone's ability to maintain a healthy weight or lose weight as actually PCOS interventions. So that might be dieting. Um, in modern medicine, we also have things like the GPL1 medications. The most famous one is semaglutide, like Ozempic. That's
Mhm.
not good when you're pregnant, but it can help people lose weight and restore ovulatory cycles, or even things like surgery. Weight loss surgery has been associated with higher rates of fertility because people start ovulating normally again as their body weight decreases. And sometimes it's a hard conversation to have with your doctor, especially for people who've had bad interactions with the medical system about weight or have tried to lose weight on their own and haven't been successful. But it's worth knowing to yourself that it doesn't have to be a huge amount. Like I said, this actually is good for many reasons to have a healthy weight, but also good for fertility. It's very specifically helpful for PCOS patients.
Gotcha. Wow, that's super helpful. And then you mentioned the medications. What are some of the common ones that you would say a patient with PCOS might have to take if
Mhm.
they're trying to conceive?
Yeah, so we can use, in addition to the conversation about weight loss, we're also thinking about medicines that there's different types, but generally help regulate the hormones to create a normal egg or a mature normal egg every month. The main ones that we've used are letrozole
Mhm.
and Clomid. You take a dose of that every day for a few days in the beginning of your cycle, right after you've had your period, and that helps your body to create or be more likely to release a mature egg. And then that egg is fair game for actually conception and having that pregnancy start from that egg. Historically, for some people who had both PCOS and diabetes or like pre-diabetes, they use a medicine called metformin. Metformin's not really recommended just for PCOS, but we
Mhm.
know that people are taking it for other reasons, like diabetes and insulin resistance. Actually, they also are more likely to ovulate, to release a mature egg. So sometimes you'll see that as a recommendation for people who have both these conditions. But the main medicines that we really think about are letrozole and Clomid as sort of first line medications for helping people with PCOS conceive. Letrozole probably being the number one with a bullet.
Got it. Wow. We've seen some patients get those medications, but also paired up with progesterone or HCG. Is that a
Mhm.
common kind of combo that happens there?
Yeah, so all of it is sort of increasing your chances of one, being able to have a mature egg that comes out of the ovary, and then the likelihood that you can conceive with that egg. So that might involve taking the letrozole, taking the Clomid. Things you can add on include actually watching with an ultrasound during the cycle, monitoring those little follicles around the eggs to make sure they're getting bigger and actually ovulate. Sometimes we can use an HCG shot, which actually encourages ovulation, makes the ovary actually release the egg into the tube and the uterus. And you can also do things on the other side, like actually help sperm get to that egg. That's in uterine insemination or intravaginal insemination around the time that ovulation is happening. And each one of these little steps kind of builds on the likelihood that you can actually conceive with that egg. That's more likely that you'll be able to become pregnant during that cycle.
Gotcha. So
You
there
mentioned,
are,
oh, go ahead.
no,
Sorry.
go ahead.
You mentioned progesterone as well. Progesterone is a useful medicine for kind of resetting the whole cycle. So, if you're on your letrozole, on your Clomid, for whatever reason, that mature egg may ovulate and not fertilize. Most of them don't. To give yourself a new cycle, you can use a short burst of progesterone to kind of reset the whole clock. And then we can try the process again. Just odds are eventually, the more mature eggs you have, the more likely it is to conceive.
Gotcha. So there's a lot of different options for people with this condition.
Mhm.
Um, just as a final thought, I think it's important is what should people do that have PCOS who might be on the early parts of their journey or are have been trying for some time and maybe struggling?
Mhm.
What's kind of the one tip that you would recommend for them?
It's a good question. I think I think uh, having a clear diagnosis of PCOS is really helpful, making sure we know that that's contributing to problems with fertility because that sort of targets all of our future interactions. Thinking also about other things that can contribute to infertility. So you always want to maximize the chances of getting pregnant. So that's like avoiding things like smoking, um, knowing that people who are in older ages are less likely to conceive, and kind of bringing all of that to the table at the same time is a big part of sort of getting all of your ducks in a row as you're moving forward with PCOS and infertility. But
Yeah.
then also to realize like there's so many options. PCOS is so common. We have a lot of good things that we can use to help people, whether that's just understanding what's going on and trying to sort of plan around when people are ovulating, whether that's just using oral medicines to help that mature egg develop. And then for people who that's not enough, moving on to more intensive procedures like in vitro fertilization. In vitro fertilization is a good option for a lot of people struggling with infertility, but it's especially good for people who are just affected by PCOS. IVF is very successful because they can really control the development of those mature eggs and eventually use them to produce a pregnancy. So that is they like taking care of PCOS patients because their outcomes are so good. Most people don't need to go directly to IVF, but just to know in the back of your head that you have so many options and a lot of help is out there for this really common condition.
Perfect. Well, those are all the questions I had for today. Um, is there any final thoughts or remarks that you want to leave off with?
Think of what else I wanted to say.
Yeah.
Hmm. I think we hit most of the high parts. I do think having a good conversation with your doctor at the beginning of your PCOS diagnosis to sort of establish what your priorities are is really important. Because if your doctor doesn't know that you're really hoping to conceive, they might recommend things like birth control, oral contraceptive medicines, which are helpful for PCOS, but not helpful if you're trying to conceive. And not missing each other at the very beginning is an important thing to relay to your doctor and be clear about.
Perfect. Well, thank you for coming on and sharing all this wisdom about PCOS and fertility, and take it from there. Thanks.
Sounds good. Thanks, Sue.
Bye.